Hey everybody, here with, introduce yourself.
My name is Khalil Ali. I'm a third-party coordinator at Tripod Fertility.
Amazing. So the other day when we were doing our clinical meeting, I was thinking to myself, we got into talking about sperm, semen, all this fun stuff. And I was thinking, I don't think a lot of people actually know this probably pretty basic stuff they should know about male fertility and factors that play into their ability to have children down the road. So I was thinking we could chat and talk about some of this. So thanks for hanging out with me. I guess the first thing is let's go through the basics of chatting about male anatomy in terms of the testicles. I know you and I had talked about like there's purposeful reasons why they are designed the way they are. So give it to me.
It's actually a great topic to talk about testicles, and it's funny that a lot of people don't actually realize that they are outside. They know they're outside of our body, but they don't know the reason why. And the testicles and the sperm are created. Sperm is created in the testicles, and they need a temperature of around 34 degrees Celsius. Inside our body is around 37 degrees, so that's why they're hanging out there. And if you notice, sometimes when it's colder, as a male, if it's colder and it's outside, your testicles end up coming slightly higher into your body so that it maintains that temperature. The sperm itself is created inside the testicles in something called the seminiferous vesicles, where they kind of go and they go over a process. They take about 2.5 months to create. So we're always producing sperm. It's not something that's that you have like women's eggs. It's always going out throughout our life. And about every 2.5 months, we have a new batch of sperm being produced. That doesn't mean that everything is just wiped out in a new batch, just on a daily process. The sperm starts in the seminiferous vesicles and works its way through, and then afterwards it goes through the epididymis, which is sitting on top of the testicles, and that's where it picks up some other fluids and some nutrients, so the lubricant, as well as some fructose, some calcium, and things to help the semen at this point in time swim all the way up when it's ejaculated into the woman. So that's a little bit about the testicles, why they're outside, and how they work.
So obviously temperature control is almost a natural thing that they just know what to do.
Correct.
Okay, cool. All right. So when you talk about the reproduction, I'm curious. Now you did sort of touch on it, but let's say, for example, somebody's, I'm going to kind of mix a few questions into one. Somebody's sperm isn't super. All things considering, when you're young, we assume a lot that we probably shouldn't assume, that everything is good, right? We do it with women too. We assume our eggs are amazing because we're 22. But unlike our eggs that are kind of all we got when we're born, you guys can reproduce. Tell me how that works. And obviously, if you have really poor quality, then there must be some light at the end of the tunnel.
Right. So like you said, we reproduce at all point in times, and just like our health, the cells inside our body is forever changing. Sometimes you're a lot healthier and you're doing a lot more, and then other times you feel like you just can't do anything. So there are some factors that do affect the sperm quality, and some of them, the notable ones, the easier ones to change, are the lifestyle modifications. You do have some genetic diseases that there's nothing that you can do about, but we like to talk about the ones that we can do something about. Let's start with smoking. Smoking in and of itself causes your sperm count to decrease. And that being said, it's not just one cigarette, let's say, for your lifetime. It's somebody who is continuously smoking. That's what kind of affects you. Alcohol intake. Think about your body. When you drink a lot of alcohol, how you feel drunk after a night of maybe 5-6 beers. So when that happens to you, that's something that happens inside your body on a cellular level and affects the sperm quality, right? So that affects that. And like I mentioned a little bit earlier, talking about how the testicles are outside of the body and it needs that temperature. When you decide to wear tighter clothing, or you do exercise, you do a lot of bike riding where you're compressing your testicles, sitting on the seats, or anything that could literally compresses your testicles. will affect that temperature control and cause your sperm to decrease. So small minimal changes like decreasing the alcohol intake, decreasing the smoking, wearing looser clothing, eliminating some of those exercises like bike riding for long periods of time. Like like if you want to go on your bike and you're riding from here to work, once a week, twice a week, it can help for your exercise levels, but it can cause a problem with your sperm count. One thing that's also very great is being active. Obesity plays a factor on many levels, including causing hypertension, diabetes, and those all processes will affect the sperm quality eventually.
So obviously overall health, right? We talk about it on every level in terms of how our fertility is affected, but it's clear obviously that there are specific things in terms of testicles that are needed to be noted early. I want to talk about injury for a moment. Okay. Just, I hear it because I have two boys and they're constantly talking about someone getting kicked in the pants. And so is this something, and I'm curious because the testicles are outside the body, is this something that actually is of huge risk to males? And can it have a lasting effect in terms of somebody getting injured? Because we have, boys are boys, but we also see it with sports and, really active hockey, soccer, those kinds of things. Is it something that could cause, damage?
So that's a great question. And like you said, most of the things that we need protecting are inside of our body. Like think about, for example, our lungs and our heart are all protected by our rib cage. Our testicles, unfortunately, are outside our body and not really well protected. With that being said, a very high trauma, so a kick to the pants, or a slap shot from a hockey puck, all of those things can cause severe damage that can be for long lasting. So you notice that in any of these high contact sports, whether it be hockey, mixed martial arts, even football, you notice that they all have to wear jock straps to protect yourself from those injuries. Because at some point in time, a very high velocity impact can actually rupture the testicles, which can cause long, forever lasting damage.
Yeah. I'm sure you don't want to talk about that for long. Okay, so I'm going to go to sort of the fertility stuff because we talk about this frequently. We're always doing different tests, and so that people kind of understand a little bit about what we go through in terms of, a couple coming in. There has to be a male part to this, and what you guys normally go through for testing someone who is contributing their sperm to this. Oh, and while I'm on this, what is the difference between sperm and semen?
Okay, so let's start off with what's sperm and semen.
Yeah.
So semen is what you would see when you ejaculate, right? That itself contains sperm. Sperm is a cell that will eventually fertilize an egg, and the sperm, which I told you, which is produced in the testicle, comes out into the epididymis, which then gets other products into it, which is the lubricant to allow the easy swimming of the sperm cells, as well as some nutrients for that long journey that it takes from when it enters inside the vagina to swim all the way up to the fallopian tubes. And that whole fluid that is released as ejaculate is what we call semen.
Got you. So sperm is a part of the semen.
Correct.
Obviously the very important part.
The very important part. No sperm, doesn't matter. If you can have absolutely no sperm, but still ejaculate, so that you're just ejaculating semen. And therefore that's also can be a cause as to why somebody may not be able to get pregnant or impregnate their partner because they have no sperm.
That's interesting. Okay, so tell me what, someone comes in, let's say it's a same-sex couple, they come in, what are the battery of tests you guys do in order to be able to move forward?
Right, so first things first, we'll always do an infectious disease screening just to have an idea of what we're getting ourselves into in terms of anything that they may have, so we can take extra precautions if necessary with the semen sample. Then the individual will produce a semen sample, We will collect that sample and we test a number of things. Firstly, we will check to see that it actually liquefies. So as it comes out, it's a little bit clumpier, but we wait for about 30 minutes to make sure that it's completely liquefied and it's almost like one consistent texture.
Okay.
After that, we will check how much volume is produced and the pH of it, because all of these reference ranges will have an effect on the sperm itself. And the most important things that we are looking for when we do a semen analysis is we're looking for the volume, first of all, then the amount of sperm that's seen on microscope. We will also look for how much of that sperm is moving, right? And how much of it is moving in a progressive manner. Sperm is supposed to travel almost in a straight line, but sometimes when we look under a microscope, we see that the head is here and the tail is just propelling it in a circular fashion. That sperm will almost never make its way to make that long journey towards the egg for fertilization.
Right.
So besides the volume, the total amount, and the motility, how it's moving, we will also look for the morphology. So we'll actually look at the sperm itself and make sure that there's a head, that there's a neck, and that there's a tail. That the head looks how a sperm's head is supposed to look like. The tail is there, and that the tail is propelling it forward, and that the neck does not have any cytoplasm, any extra fluids inside there. And then we look at the actual overall semen to ensure that there are no bacteria, white cells that can let us know that there's a possible infection that's also there as well.
Wow. Okay. So I know I let's talk about ICSI, because I know this is something that maybe, well, a lot of people probably don't know about until they get into fertility issues. So tell me what ICSI does to what it stands for, and then basically what it does in terms of helping get around some of these potential issues, if there is some.
Okay, so that's a great question. So before we can answer how ICSI works, we have to understand what ICSI is. And ICSI means intracytoplasmic sperm injection.
Okay.
So when doing IVS, there's two essential processes. One is you're going to get those eggs, you're going to put them in a petri dish, and then you're going to put a little bit of sperm around there and let the sperm naturally swim towards that egg, and then one of them will fertilize that egg. ICSI, on the other hand, is saying that we're looking at the sperm is not able to swim as well for whatever reason, or maybe there is a process, there's something wrong with the head. We will then take a single sperm that we deem suitable. We will cut off the tail of it, and we will directly inject that sperm head into the egg for it to help with that fertilization process.
Wow.
Yes.
Wow. So you can kind of avoid, so if mobility is an issue, you can theoretically get around that by just hand picking all of the best dudes in there and and just making the the vacation traveling much shorter and injecting them. That's pretty amazing. How long have we been able to do that scientifically?
For quite some while, but you also have to remember that there is the pros and the cons of that as well.
Okay, tell me
right? And yes, like you said, the mobility, the motility issue where you can just put it inside. But remember that the egg is there, and then when you actually puncture inside the egg, there are chances that egg might not be able to withstand. Right? So you're giving the sperm their best chance, and you're hoping that egg will work. So it's a little bit of a give and take. It's not that okay, we just put it inside and then that's a perfect solution, because then everybody would do ICSI all the time.
Right. So it is always better if you let them do it on the al natural way.
Correct.
So technically, and it's because I'm like super curious about this. Technically, you get the eggs, you have the sperm, you just throw them in a petri dish and let them have fun, or?
No, that's a good question. That really is a good question. Unfortunately, it's not just like that. Okay. Once the sperm is once the patient produces their sample, that sperm will have to be washed, because there are a lot of dead sperms in there. Remember, they are reproducing at about every 3 months, 2.5 months. But so you will have some dead, you will have some skin cells, you might have some extra lubricant. There's a possibility of everything else. So we go through a sperm wash where we essentially remove all of those not so great ones, and we come down to a little bit better sperm that are swimming properly. And then at that point in time, yes, we do put an egg and we let some sperm go and have fun.
So you do one egg, obviously on purpose, and then but essentially you just do one sperm, or do you just kind of throw a bunch of good ones in there and let them?
You can't do 1-to-1. There's a reason why we produce about a million, or well, not a million, more about like 40 million at least sperm per ejaculate.
That's a lot.
Yes,
Wow.
it definitely is, because a lot of them don't make the journey. Some of them might not be able to penetrate the wall of the egg to get inside for the DNA to be matched. So yes, you need to put more than just one.
That's pretty incredible. I actually watched a video one time that I thought was the most fascinating thing I ever saw. And if I could find it, I'm sure there's probably a bazillion out there now. It was a long time ago. And it showed kind of the journey that, the sperm makes, but then also what exactly happens at the precise time when it's able to penetrate the wall, and how it basically closes back up and the egg just knows, okay, one's in, that's it. It is really remarkable. And I remember showing it to my kids. Okay, kids, this is how it works. I think everybody should get this really, it was a really neat video that kind of explained it through, charades. Okay, cool. So I wanted to ask you another one about semen DNA fragmentation, because we do this sometimes. And I've over the years of working in this industry, it's been an interesting, why do we do it? What special circumstances? So can you tell me a little bit about that?
So first of all, you have to understand why we're going to be doing, or why a doctor might be asking for DNA fragmentation. DNA fragmentation is it comes out to be a percentage. But okay, so for why do doctors ask us to do a DNA fragmentation? Because generally there's a higher level of infertility. You might have a good count, a good number, a good motility, but for some reason there's still a fertility issue and you're not getting pregnant. So they want to see what's going on. And what DNA fragmentation is checking to see if there is damaged DNA within the sperm. Right? So the higher the DFI, or the DNA fragmentation index, the larger percentage of damaged DNA. So this is a process whereby a technician will take a sample and put some dyes and open, essentially. Let me not say that part because I can't remember exactly what it is doing per se, but so it's a process where a lab technician will analyze the sample and then measure how many is fragmented versus how many is not fragmented.
So it's basically like, in layman's terms, broken down DNA. So the ones that are, not as, we think of DNA in the strands, not as perfectly united as opposed to kind of crumbling apart. It's interesting. So you wouldn't necessarily do that off the hop. You would only perhaps do it if consistently everything looked good, but then still there was no pregnancy, or still, ongoing miscarriage maybe, or something going on.
Correct.
Okay, really cool. Okay. I think that's kind of all I had. What advice, we'll leave it on this. What advice would you give young men in terms of their sperm and protecting their fertility years? Because I think we have it, I know I have I have recollection of guys when they were younger and we hang out and they'd be like, they think the sperm, my sperm's great, my sperm's great. But we are seeing this more and more and more, where everybody just assumes if I'm healthy, everything's fantastic. But there are significant lifestyle things that choices that can alter it. What would you say to your younger self, or to young men to say, some advice about your sperm?
Right. So like I mentioned, previously, there are some of those genetic factors or some disease processes that you may have that you can't change. And unfortunately, they are what they are. But
Right.
to give ourselves the best chance that we possibly can have, like anything else, is first of all, be healthy, right? That means get moving, just be a little bit active. It doesn't have
Yeah.
to be that you're hitting the gym, for 4 or 5 hours a day. No, but a little 30-minute walk every day does a lot for your cardiovascular health and that blood flow, which will then give the nutrients to all parts of your body, including your testicles.
Mhm.
That's the first part. Second part is your diet, right? Make sure that you're eating healthy. Eating healthy means being healthy, right? So let's get those recommended fruits and vegetables into your diet. And as much as I loved my fast food when I was younger, I would recommend cutting about half of it out. All that
Yeah.
processed foods with the added hormones, there's lots of problems in and
Yeah.
of itself, and we can go on for days on just talking about that.
Yeah. Yeah.
Another big one is preventing sexually transmitted infections, right? Because some sexually transmitted infections do affect your sperm. So like chlamydia, gonorrhea. So ways to avoid it is using protection,
Mhm.
and vaccinations against whichever STIs that you can be vaccinated against.
Right.
Another major one is stress. People don't understand how much our mental health plays an effect on our life and our sperm production. So there will be things and there will be times where you're extremely stressed out, but managing that stress and finding your outlets in how to cope with that is also definitely a big point. And then one thing that I would love to tell a lot of people is that we've changed our lifestyles a lot over the years, and the fashions and the fads always go through different changes. Like I mentioned, that the testicles are outside the bodies to maintain that temperature. Wearing tighter clothes means a compression on on your testicles, compressing closer to your body, which will then increase that temperature around the area. So it's something to look out for. And that definitely is a cause for a lower sperm count, a low and changes. So those are some of those things that I can give. And then there are also some vitamins and nutrients that you can take that will help the sperm to be able to swim better. So then those things can be recommended by your physician.
Okay, I have one last fun question. Underwear or no? Does that impede? I have this debate with friends all the time, and my partner is kind of yeah, in the winter, maybe summer, free flowing. He's always kind of like, I don't know if we're supposed to wear underwear. Give it to me. Does it make any difference?
Well, that's a good question, right? It depends on what you're wearing, right? It depends. Are you wearing Speedos or compression underwear, which are like trying to just hold everything in,
Right.
or are you wearing boxer briefs, which are a little bit looser? I mean, to when you get into the nitty gritty details of commando versus non-commando, as it's colloquially called in men lingo, you can go either way. Because think about it this way: imagine putting on a pair of jeans, and that zipper hits your skin. Not a fun time.
I feel like I've heard this story a few times.
Right. So
Right.
depending on what you're wearing, will also play into that effect. And again, if it's tighter underwear, for a prolonged period of times, it's kind of not advisable. So wear something that's a little bit looser.
Okay. All right. Well, thanks for all the nitty gritty on Testicle Friday. I appreciate it. And I'm sure we'll have you on again to chat about something else.
Not a problem. Anytime, Angela.
Thanks. Yeah.